Today we're going to talk about separators, and I get a ton of calls about separators falling out, and I want to assure you that it is not an emergency. Most of the time when a separator has fallen out, it means that it has separated the teeth apart. The purpose of a separator is to create space so that we can fit an appliance or a band or something on that tooth, okay? So most of the times when it has pushed the two teeth apart and it's become loose and it's fallen out, it means mission accomplished, it's done its job. Now if it's fallen out maybe a week or two before we have you back, because we usually place a separator a lot of times and we'll have you back 2 weeks later, and so sometimes it doesn't always make it that 2 weeks. It's probably okay, give us a call and we can talk you through it, but to save you a trip into the office, here's something that you can do. We're going to give you some floss and some extra separators to take home, so you should have that already. But I'm going to show you kind of how to place a separator. So this is how we do it. We use this little separating player. You of course don't have that, but you can see the concept. What it does is it separates it, makes the elastic thinner, so it allows it to slip in there a lot easier. Okay. Alright, you can see that separator's placed. Okay, so that's one way to place it. Alright. Now at home, what you can do is you can take the separator, you can take 2 pieces of floss, and you can just kind of stretch it out to make it thinner and do the same thing. Okay, now you just want one of the pieces of the O to be underneath the contact and the other is going to be above. Can you see how that's above? Okay, so on this side we're going to floss this in, and then you just pull the floss out. Super easy. Your floss does not necessarily have to be the length of a football field like we have here, but grab a healthy size that you can work with. Okay, if you ever need to take it out, we have scalers. Okay, I don't encourage you to take it out, but you can kind of get a toothpick or a scaler and kind of get it in there and kind of pop those out if you need to. Again, no need for you to ever have to pop those out, but this is how you can put them back in to save yourself a trip into the orthodontist. If you have any other questions, please reach out. We'd be happy to answer anything we can.